Hello and welcome to this first edition of the Daily Report. I'm Min Sun-hee and it's Tuesday, October 5th here in Korea. We start the program with a look at the latest events on the pandemic front across the globe. I have Kwon Soa standing by with the tallies and more. Soa, welcome.
Great to be here back with you for our news show, Sunny.
Right, that's good to know. So now let's begin then with the local figures.
All right, let's do that. Korea has been seeing a decline in COVID-19 cases in recent days, but we have to keep in mind the holiday and weekend factor, and that has maybe dropped the figure to 1,575 as of 12 a.m. this Tuesday. And that includes 1,557 domestic transmissions and 18 cases from abroad. Now, as fewer testings, of course, I said, is maybe the reason for the decline, but it is good to see that for the second straight day, infections have been below 2,000. Nevertheless, for over 90 days, cases here in Korea have been at above 1,000. Now, let's take a closer look now where the recent cases have occurred. There's been an overall drop in the capital region here, 521 in the capital Seoul, a drop to below 500 in Gyeonggi-do province, and 106 cases in Incheon, but an increase was reported in the southeast of the country, especially in Gyeongsangnam-do province, as well as in the city of Busan. And let's take a closer look now at the total number of infections. 321,352 is the accumulated caseload here in the country, and with 11 additional fatalities, the death toll stands at 2,524. And for an update on the vaccination front, 39.7 million people here in the nation have received at least one dose of COVID-19 vaccine. That's 77.4%, while 53% have now been fully vaccinated. And as part of the government's fourth quarter inoculation plan, teens aged 16 to 17 can start making their reservations for vaccinations this Tuesday. Let's move on to some figures abroad. The total number of cases stands at 236.1 million, with 4.8 million fatalities linked to COVID-19. And on our next table, we have the 20 countries with the highest number of accumulated cases. The U.S. at 44.6 million infections is seeing an average over 100,000 infections a day. The U.K. had over 34,000 infections reported in the past 24 hours. Meanwhile, here the Philippines has hit 2.6 million in total, with more than 10,000 infections reported in the past day. And those are the general updates I have for now, but I'll see you back in a bit. Sunny?
All right, so thank you for that. Right, now local authorities have announced a plan to facilitate vaccination verification for those who receive their COVID-19 inoculation abroad. For more on this, I have our Cho Won-jung here in the studio with me. Won-jung, welcome.
Good to be here.
Right, now I hear there have been some hurdles in proving vaccination status, right?
That's right. So like you said, authorities will come up with new ways for people to show their proof of a vaccination. A lot of people from overseas who had gotten their COVID-19 vaccines outside of Korea have found it difficult to prove their inoculation status when visiting coffee shops and restaurants. Here's what the government had to say this morning.
There have been cases where people who were fully vaccinated overseas could not provide proof of their vaccination status, which made it difficult to provide them with incentives, such as exemptions from rules that govern private gatherings.
That's why the government has worked on more effective ways to verify the vaccination status of travelers who got inoculated abroad, as well as U.S. soldiers stationed in Korea. Starting October 7th, those who come to Korea with the quarantine exemption document can register their information online using apps like Kuv at local health centers. However, it only applies to those who received COVID vaccines that have been approved by WHO. Meanwhile, young teenagers here in the country can sign up for COVID-19 inoculation from today, right? So starting today, Tuesday here in Korea, teenagers age 16 and 17 will be able to book vaccine appointments with their parents' consent. As it has been done previously, registration can be made online starting 8 p.m. Korea time. Beginning October 18, the first children in this age group will get the mRNA vaccine from Pfizer with a 3-week interval between the first and second dose. For kids between 12 and 15 years old, the booking window starts on October 18th and their vaccination will kick off in November. Again, their parents have to give their consent. Also, bookings for a third and booster shot will also be open this Tuesday from 8 p.m. Korea time. Those over 60 and most medical workers will be eligible to receive their extra jabs. Now, this comes as health authorities have been seeing numerous breakthrough cases due to the Delta variant.
Right, and Wonjung, for the sake of comparison, what can you tell us about the booster shot campaigns elsewhere?
Sure, so Europe's top drug agency has approved the use of booster shots for people 18 and older. The European Medicines Agency said Monday. This will be the case for all adults and will be available for people at least 6 months after they've gotten their second dose. They will get the Pfizer vaccine. What's really interesting is that this encompasses a much broader age range that the U.S. FDA, with the booster shot only being approved for Americans aged 65 and older. In the U.S., Johnson & Johnson's Janssen vaccine is seeking FDA approval for its booster shot. The pharmaceutical company will be submitting the necessary paperwork this week. The Janssen product is a single-dose vaccine. The FDA and outside experts have been discussing whether to give the green light for this vaccine, and a decision is expected in the coming weeks.
I see. All right, Wonjung, as always, thank you very much for that.
Thanks for having me.
Right, now for the latest remarks from authorities here regarding their containment efforts and more, I have Soa back at the desk. Now, Soa, welcome back.
Hi again, Sunny. So we are back from another holiday and another one is coming up next week. And this is why authorities are really on high alert. And Prime Minister Kim Boo-kyum this morning noted that people have become less vigilant. Let's take a listen.
The expressways were very busy over the National Foundation holiday. There was just as much as movement when compared to Chuseok, and people flocked to department stores and shopping malls as well. At some places, basic prevention guidelines like mask wearing were not strictly followed.
So this trend is continuing despite the ongoing fourth wave, and another senior health ministry official has echoed these words by the Prime Minister at an earlier briefing, so citing the recent trend in domestic cases.
Due to the
effects of the Chuseok holidays 2 weeks ago, infections rose in both the capital and non-capital regions. The metropolitan area saw a daily average of 1,865 infections last week, a 20.9% increase, while 624 average cases were reported elsewhere, a rise of 28.5%. Due to the nationwide spread, the reproduction rate of the virus stood at 1.2 last week, climbing for the fourth straight week.
And Sonny, in the nationwide increase in that span, which is from September 26th to October 2nd, according to Son, surged by 22.7%, and an average of 2,490 cases were reported in that span on a daily basis. And most people who have been infected recently were unvaccinated people or people that were just partially immune, and among those also foreign residents as well as the younger population. In fact, close to 6 out of 10 people were between the ages 20 and 49, and more than 24% were foreigners. And yes, so this trend keeps to be continuing even after the Chuseok holidays,
right,
and also the National Foundation Day.
Right, and by partially vaccinated, you mean having received at least one dose?
Right, exactly.
Right.
But also people who got their second dose but have not been past that 2-week span after which the efficacy kicks in.
Right, of course. Moving on, so what is the latest with regard to Korea's adoption of a vaccine passport then?
Well, Sunny, ever since the concept of a vaccine pass has been mentioned here in Korea by officials, which would allow fully vaccinated people to access certain public facilities such as entertainment venues like cinemas. So ever since that has been mentioned, there have been growing concerns regarding those who don't possess a vaccine pass. And this is what Prime Minister Kim Boo-kyum had to say on the issue.
The system must be planned out in a way that actively supports the return to normal for fully vaccinated people, but it's also very important to make sure unvaccinated people are not discriminated against or left out. I ask related ministries to make preparations in advance through the soon-to-be-launched support committee for the restoration of our daily lives to gather sufficient opinions and build public consensus.
Right, and so what has been shared about the validity of these vaccine passes? I mean, how long will they last?
Well, Sunny, there have been questions raised about that, whether that could be a span of around 6 months, because that's the case in many other countries who have already launched such a vaccine pass system. And Korean officials have also been citing that span abroad. But for now, nothing has been said, according to Son Young-nae, the official at the earlier briefing. But what he did say is that such a system will be a temporary one, as the vaccine passes will be less in need once vaccination rates are high enough. So eventually that system may be discarded.
I see. All right, so thank you very much for that.
Anytime.
The age limit for COVID-19 inoculations has been lowered to 12 here in the country, adding greater momentum to hopes for herd immunity and an eventual return to some normality. Having said that, we turn now to our Chun Song-cho, who is at a local vaccination center, to give us a glimpse of the efforts there. Song-cho, welcome.
Good afternoon, Sunny.
Right, so what's the atmosphere there like, Song-cho?
Well, I have to say, I was quite blown away when I first got here, how there's so many people at the vaccination center. Previously, what used to be a sports venue. So this is a vaccination center in Jungnam-gu district, southeastern Seoul. Every single day, an average of about 700 people come here, roll up their sleeves, and get their COVID-19 shots. And as the country's revving up inoculations, the center is open for services every day except for Sunday. So why don't I show you around the center a little bit? So whether it's for a walk-in or an appointment, you will get a pre-vaccination checklist that will ask you very important questions to help healthcare providers determine if there's any reason why you shouldn't get the vaccine on that day. So you get the checklist to the booth over here and talk to a healthcare worker, a doctor. And then here is the waiting area where you wait for a little bit for your shot. You will move over there in the booths to get the vaccine that you really need. So this is what an average vaccination center looks like in the country, of which there are hundreds in the country. These centers really play a critical role in boosting the country's vaccination rate, which stands at over 53% for the fully vaccinated as of today. And on top of that, the country is really speeding up its vaccination drive. So starting today, the vaccine reservations for adolescents aged 16 to 17 will be able to make their reservation. And starting Friday, pregnant women will also be able to make their reservations as well. So it looks like the country is really well on track to reach herd immunity ahead of its October plan. So since I'm here, I'm going to talk to a healthcare worker over here. 안녕하세요.
안녕하세요.
네, 안녕하세요. 저 그럼 혹시 그 백신 접종 때 주의해야 할 점들이 몇 가지가 있는지 여쭤봐도 될까요? I'm going to ask her what are the precautions that we need to watch out for when getting the vaccine.
네, 코로나19 예방접종 시 접종 당일에 몸 상태가 좋아야 되기 때문에 충분한 수면과 또 안정된 마음가짐이 필요합니다.
So the most important thing is that you are in the right condition for the vaccination. So have enough, plenty of sleep, and then also make sure to relax and calm.
건강한 성인의 경우에는 37.5도 이상의 발열이 있거나 또는 중등도 이상의 급성 질환으로 치료받고 계시다면은 예방접종을 좀 늦추시는 게 좋겠습니다.
So if you have pre-existing conditions or if you have fever over 37.5 degrees Celsius, then you may want to wait for your vaccine a little bit.
고혈압이나 또는 당뇨 같은 만성 질환을 가지고 계신 분들은 평상시에 약을 복용하고 계시는데 예방접종 당일에도 평소 드시는 약은 꼭 드시고 오셔야 하고요.
If you you have chronic illnesses like diabetes or heart conditions, then you have to take your medication as well as the vaccine on the day.
그리고 또 중증 질환이나 희귀 질환, 또 면역 억제제라 스테로이드를 복용하고 계시는 분들은 담당 의사 선생님께 상의 후에 예방 접종을 결정하시는 게 좋겠습니다.
And if you have pre-existing conditions that require medications like steroid, then make sure you talk to your doctor before coming to the vaccine center.
네, 그리고 가장 중요한 것으로는 이제 알레르기 병력이 있으신 분들은 예방 접종 예진 시에 이를 꼭 밝히시고요. 또 상의하셔서 예방 접종 가능한지 여부를 확인하시는 것이 좋겠습니다.
And also, what's important is that if you have any history of allergies, then make sure you talk to the doctor before getting inoculated. 감사합니다.
감사합니다.
감사합니다. So yes, you may feel pain, discomfort, or stress during vaccination, but there are a number of techniques you can use to a little bit of for the alleviation of the pain. For instance, you want to make sure you loosen up you relax your arm to make it feel loose and jiggly. Use plenty of deep breathing to make yourself calm down or relax, and then also drink plenty of fluids to reduce any discomfort from fever. And if you want to learn more about the disease or to report side effects, then please contact the KDCA's hotline 1339. This has been Chun Sung-cho reporting live from Jungnam-gu District and back to Sunny in the studio.
All right, Sung-cho, thank you very much for that coverage. Hopes are high for a phased return to normality early next month as inoculations have been expanded to cover more age groups and to allow for more protection. However, containment remains a challenge, with the daily tally having yet to mark a tangible retreat. For more, I have Professor Chuseok from Hallyu University. Good to have you back, Professor Chung.
My pleasure to be here.
I also have Dr. Kim Seung-taek from Institute Pasteur Korea. Welcome back, Dr. Kim.
Good afternoon.
Professor Chung, let's begin then with your assessment of the current COVID-19 situation here on the local front.
Well, we had more than 3,000 daily tally some 10 years ago.
10 days ago, you mean?
I see, yeah, 10 days ago. That's 24th September. And I really do hope that this is the highest one until the end of fourth wave. But the statistics are not very favorable. As government officer announced today, 2 weeks ago, average daily tally was around 2,000, and last week was 20% increase, is 2,400. That is a consecutive increase for last 3 or 4 weeks, and on top of that, reproduction number is 1.2, highest since July. But I'm more hoping that things will be going on a very stabilized condition because of vaccination rate is very high. So some 10 days ago, fully vaccinated rate was only 43%, and this, as of today, is 53%. Almost 1% increase every day during last 10 days. So if that means 10% more population is protected by COVID-19 by having a fully vaccinated. So I really do hope we'll see a decrease of daily tally and also decrease of severe cases, and also case fatality will be decreased by having a fully vaccinated people more than current situation.
Right. Dr. Kim, as Professor Chung has pointed out, the number of those who've been fully vaccinated here in the country stands at 53% of the population. Now, what can you tell us about the impact of our inoculation efforts on containment measures?
Well, I think the number one effect that we would see is the decreasing number of just severe COVID-19 patients. And although the now just as just more people are just vaccinated, we will see just more of just breakthrough infections. That's for sure. I mean, that's also what we are actually observing from the other countries, for example, like Singapore and UK. So there will be just more just infections, but then we will see just a decreasing number of just severe COVID-19, also just a less percentage of the case fatality as well.
Right. Also, the vaccination front now. Neighboring Japan has fully vaccinated over 60% of its population against COVID-19. And just last Thursday, authorities there lifted their state of emergency following a new leadership within the governing party. For more, I have William Pasek live on the line. William, good to see you again.
Greetings.
First up then, William, Mr. Fumio Kishida was elected Japan's prime minister in a parliamentary vote on Monday, and he has pledged to make the country's fight against the pandemic a priority. Could you tell us a bit more about this?
Well, I mean, certainly it's very, very early days for his government, and we're still trying to figure out exactly how the COVID situation, the COVID strategy might change under his leadership. So far, he's called for a kind of wholesale review of where Japan has come from, where Japan is at the moment. And the vaccination situation here, the vaccination rate here is above 60%. So Japan has come a very long way in a very short period of time that the state of emergency is ending. However, Japan is in this kind of California-like cycle where it gets the cases down, it opens up, the infection rates increase again, so it closes down again. The question is, are we breaking out of that cycle now? Is this particular lifting of the state of emergency, is this something different than we've seen in recent months? And it's still hard to figure that out as we sit here.
Right, it is, William. Meanwhile, what has been the public response, William, to the latest political events in Japan?
Well, you know, I was just thinking, I've been in Japan long enough to have experienced 10 prime ministers. Mr. Kishida is my 10th. And I have never experienced less excitement about a shift in government. I think basically everyone knows that Mr. Kishida was chosen because he was kind of the least risky candidate. He was the safe choice. He's the least likely to significantly shake things up. And when you look at how the stock market is reacting in the last couple of days, not that markets always get things right or wrong, but the market is not very happy with this choice. We had a bond auction today in Japan that had very weak demand. I think investors are looking at the change in government and they're in some ways voting with their feet, and they're saying this does not signify change.
William, prior to his departure, former Prime Minister Suga declared an end to the state of emergency in Japan last week, and this past weekend was the first one that Japan got to enjoy, perhaps, following an ease in COVID-19 restrictions. I suppose there was much celebration with regard on that front?
Yes, I mean, there was a lot of going out, a lot of drinking. The streets were very, very crowded. There is a lot of COVID fatigue here. So certainly people have been excited about the prospect of actually being able to take a deep breath and to live their lives a bit more. The trains are a bit more crowded. But, you know, compliance here has not been a big problem. We're wearing our masks. We're doing very well with the social distancing. The Japanese people in general, I think, have done better than the government has. We've, in some ways, if we're succeeding in defeating COVID, we're doing it because of how we're acting as a population, not so much the government. But yeah, I mean, certainly right now, people are very excited about the change in tone. However, they are cognizant that 2 months from now, given the COVID, the new Delta variant, we could be back in a state of emergency. Right. Who knows?
And just for the sake of clarification, William, shops, restaurants are open until all night, is it, or until 9 o'clock in the evening?
Well, until 8 or 9 p.m. basically. They can they can serve booze up until about 8. They can stay up until about 9. But that is actually a significant change from, say, last week when most bars and restaurants could not. So there's been a lot of people going to 7-Eleven, getting a beer, and standing outside. So I guess people will just go drink inside for now. So I guess people do see this as a bit of a return to normal. But again, there is some concern that 2 months from now, we could see the infection rate increase again. So we're hoping for the best, but, you know, fearing for the worst, I think.
Right. Professor Zhang, as William mentioned earlier, over 60% of the Japanese population is fully inoculated, and daily infections fell to below 1,000 this past Sunday after hovering between 1,000 and 2,000 in recent days. What are your thoughts on the timing of Japan's transition to life with COVID-19?
Well, that's the decision from a government. And I was very interested in when William mentioned that the Japanese people are doing better than what government is doing. So when I was working as a director of KCDC, I was looking for my counterpart in Japan, but I couldn't find anyone because there was no CDC-like organization in Japan. I found in China, and here we have. The reason why I was looking for the control tower in Japan was to communicate each other and for prevention of a future infection or current infection like influenza. So I don't know who is on control tower in Japan right now, and that man or he or she is actively steering the whole infection prevention policy right now. Looking at the Japanese situation, they are not doing tests among people who contacted the close contact but who was wearing a mask. They do not test. And if anyone who are without symptom going to a laboratory, then they do not test. So as we know, there are many patients, confirmed cases without any symptoms, about 30 to 40% are lost in Japanese statistics. Even though the government is not very active in finding patients, maybe you have more patients above known statistics, then the severe cases must occur. And then those cases have to go to a hospital and end up with admission to ICU or emergency rooms. Then the government would do something like more restricting the social distancing and etc. So the situation and environment all depends on the Japanese environment and the society. If similar thing happens in Korea, Koreans will not allow those kind of a policy, but Japanese are quite tolerable to the COVID-19 situation. They were staying at their home, even with quite symptomatic COVID-19. And some people died of COVID-19 at their home without going to a hospital. So the attitude of people looking at COVID-19 is quite different between two countries. So we'll see. But the influenza season is coming. And in Japan and in Korea, we both will be suffering from influenza or other respiratory viruses. That also includes COVID-19. So both countries are not safe in coming winter.
Right. And William, staying with that, what is actually the general stance among health experts there regarding Japan's exit strategy?
Well, the problem is there's really not much of an exit strategy per se. I think the professor has he has his fingers on the pulse of what's happening here very well, I'd say. I think in many ways we've had Prime Minister Abe, then we had Prime Minister Suga, now we have Prime Minister Kishida. So far, Japan has kind of followed the Donald Trump model of prioritizing the economy over public health. So testing is not what you would expect. For example, I'm going home to New York for Christmas. I'm trying to figure out how to get tested, where to get tested. It's not easy. There's not a very significant contact tracing program as well. And so in many ways, we worry about the COVID outlook because we don't really know what the true nature of the numbers are. I'm not suggesting that the government is lying to us. I just think the government's taken a very, very laid-back approach to this crisis. And with the Delta variant becoming a problem, more of a problem, the Mu variant becoming more of a problem, I think folks here are realizing, okay, we can maybe let down our guard a little bit, but let's be very careful because you never know what's around the corner. And the government here has proven that it will prioritize the stock market over public health, unfortunately.
I see. Meanwhile, Dr. Kim, the current prerequisites for transition into normality are vaccination and fatality rates. Now, having said that, at what levels do these two rates need to be on for a country to consider an exit from pandemic-related restrictions?
Well, I think every country has their own just standard for just transition to some sort of just life with COVID-19. But I think our government and some other countries actually think just maybe just 70 or 80% based on just anti-population, because we are also just seeing the more than 80% or 90% for certain age groups. But there are some people who are not still just eligible for vaccination, especially for very young children. So I think it's pretty much just practical to consider 70 or 80% based on an entire population. And I think in terms of, well, actually the the fatality rate, in terms of fatality rate, we're actually projecting to just a flu, just case fatality. In the case of flu, it's less than 0.1% of case fatality. For COVID-19, it's just varies depending on the countries, but it's like between the 1 to the 3%. So, but ultimately, I think every country is thinking about just the level that their own just healthcare the system can just manage all the severe COVID-19 cases. So in many cases, we actually just compare this COVID-19 to just the flu. But then, well, this is actually very good, just analogy, and then there's just a good standard that we can just compare. But these diseases are not actually equal. I mean, in many cases, very similar. These are not identical. And also in terms of just a vaccine or the drugs, the situation is quite actually different in between the two different infectious diseases. For example, like the vaccine efficacy, the flu vaccine efficacy is way less efficient than the dose for the COVID-19. For the flu or just a seasonal flu is like just 50 or 60%. But for COVID-19 vaccines, now we are seeing more than 70 or sometimes more than 90% of protection efficacy, which is much better. I mean, for the COVID-19 vaccine, and for the drugs. The drugs available for each infectious disease. Now we have more just affordable just options for just the flu than some COVID-19. For COVID-19, we have some options to choose from, but there so far we don't have any approved as oral drugs, affordable just drugs for COVID-19 as of now.
Right. William, what are the chances of authorities there in Japan reimposing COVID-19 related restrictions in the case of resurgences, as has been the case in countries like the UK and Singapore after relaxing their own restrictions?
Well, it could happen pretty quickly. I think people here also realize that the timing of this lifting of the state of emergency is a little curious because it coincides with the election process. Is this the ruling Liberal Democratic Party's effort to say, look, we've beaten COVID, we can live our lives, vote for us again? I'm not saying that there's manipulation going on, but the coincidence of timing has caught a lot of attention here. Yeah, I mean, I think people realize, again, in the last year, we've had many, many instances where we have gone back to normal, we've gone out drinking, we've gone back to restaurants, we've gone out to concerts, and the infection rates spike up again, and we're back in the state of emergency. This could be the cycle we're in. We could be back in a state of emergency in November or December or into January. And I think, again, people here are being very careful. We're wearing our masks and we're washing our hands and we're doing social distancing as much as you can in a densely populated city like Tokyo. We're doing our best, hoping for the best. But the government, again, has so far been very laid back in terms of its policies. And so will the Kishida government be more hands-on, be more proactive? Maybe, we hope so, but they do have a lot of proving to do.
I suppose only time will tell then. All right,
yes.
William, as always, thank you for your time and your thoughts.
Thank you very much.
Meanwhile, back here in the studio, Professor Chung, what can you tell us about US pharmaceutical company Merck's new COVID-19 treatment pill?
Well, I was expecting for a long time, actually for months, to get the news, very good news. Finally, we have interim analysis of phase 3 study of molnupiravir. Is quite complicated. The fear is for an antiviral agent. Most conspicuous thing is it is effective, 50% effective compared to placebo. They recruited 1,550 patients so far, but the interim analysis only analyzed half of it. But it is very effective, then they do not continue to complete the study. Instead, they would like to apply FDA for emergency use authorization. If you like to know the details of the statistics, all the recruited patients had to have a symptom within 5 days. Because if it is too late, it's not working. The antiviral agent works at the beginning of a disease. After some days, they won't work. Same is true in flu treatment drugs. So, and they have to have at least one risk factor, either older than 60 years old, hypertension, diabetes, obesity, and etc. It's quite a risky group, and divided into a true drug group and the placebo group, fake drug. And the molnupiravir, the true drug, showed 7.3% of prevention of 73.3% of admission rate. And compared to placebo, the placebo showed 14.1% of admission rate. That's 2 times higher admission rate. On top of that, 8 out of 53 were dead because of COVID-19. There was no death in molnupiravir true drug group. So this is quite exciting. And what's more exciting is it is effective in variants. So Delta variants, even mu variants, beta, gamma variants, there was no difference between variants group and non-variants group. And there was quite many number of variants in those studies. And this study was done in more than 24 different countries in the world. Korea was not included in that. And there was no adverse effect. The only adverse effect most prominent was only headache. So it is an oral capsule, 4 capsules twice a day for 5 days. That's it. You don't need to get hospitalized to get an IV drug. And people say that it's quite expensive. It's US dollar, $700. But the same equivalent drug, which is remdesivir, is equivalent to molnupiravir. That is the IV drug. This is the oral pill. It's only 1/3 of remdesivir, and only again the 1/3 of a monoclonal antibody treatment. So I don't think it's relatively expensive than compared to the comparable drug so far on the market. So it is quite promising. But we have to know more experience with that kind of drug, and I really do hope we'll see in our own market in not distant future.
$700 for 5 days of the pill, taken twice a day.
Yeah.
I see. And the pill needs to be taken within 5 days of showing symptoms.
Yeah. That's the way that the antiviral agent works.
I see. All right. Dr. Kim, meanwhile, what can you tell us about the respective and effective uses of both vaccines and treatment pills to allow for a normal life amid the pandemic?
Well, I think just recently, Dr. Tony Fauci at the National Institute of Infectious Diseases at USA just talked about that, such kind of just a relative importance of just the vaccines and the therapy. And then he said actually the vaccination should be #1 priority, and then I just fully agree with him. And then even under this COVID-19 pandemic, I think vaccination should be the #1. And then also in that we have just very effective the vaccines for COVID-19 right now. But the drugs can be a very supplementary, and then the effect, and then some assisting effect. For example, like the people who are not eligible for vaccination, and also some breakthrough infections. This vaccine should be just very useful for in that case. And then for this COVID-19, we should not also just forget about just a quarantine, even after just a very effective vaccine and then the drug development. And then for I want to again compare the flu and just COVID-19, because as earlier as I talked about, there's some different the effectiveness between just 2 different vaccines against 2 diseases. And then for the drugs, for the flu, there are a couple of just very effective drugs. For example, including oseltamivir. This is actually Tamiflu. And then the favipiravir, and then baloxavir. All 3 the drugs have all different mechanisms of action, which means that if there is some emergence of a resistance, the virus, we can actually effectively cope with these resistance issues. But for the COVID-19, well, as Professor Chung said, we have actually 2 different approaches in terms of drug development. The first one is antiviral drug, which is very effective for the very early phase of COVID-19. But in the later phase, we have to use some anti-inflammatory drugs. For example, like dexamethasone, and then tocilizumab, and then baricitinib. But in the early phase, I think the oral drugs is very important because we can actually effectively block the trend, progression to the severe COVID-19, and then this can be actually taken just orally at home, which actually could not be achieved by just monoclonal antibodies. Although there was several very successful monoclonal antibodies were developed, and this is actually very effective, like preventing the 70 or 80% of prevention to the progression to the severe COVID-19. But monoclonal antibodies has to be administered by this injection, by the needles. And then the fact that we have oral drugs is very important. And then these drugs, I think should be very affordable. And should be produced large quantities. But I think the $700, maybe this price is a little bit way over in some countries. And then as far as I know, the market is considering some different pricing policy in different countries for now. So this is a very good news.
To make the pill more affordable then?
Exactly. For some low-income countries, they might provide very low prices.
I see. All right then, Dr. Kim, as always, thank you very much for your thoughts today, and Professor Jung, thank you very much for your insights. Right, and on that note, we end our first edition of the Daily Report. We'll be back with more coverage at the same time tomorrow, so do join us then, and thank you for now.